I think if we start now.
Yeah, it's time. It's time.
I think we can start, sir. Yeah. So 1 second. Good evening, everyone. Welcome to Vayomanasa Sanjeevani Monday webinar series. Today's topic of the day is pain management. To talk about this, we have Dr. V Selva Ganapathy. I welcome Dr. Selva Ganapathy to the session. Welcome, Doctor.
Thank you.
And today's moderator for the session is Mr. Jambunathan K. I welcome Jambunathan sir to the session.
Thank you, ma'am. Thank you.
And I also welcome all the Zoom and YouTube participants to the session. On to you, Jambunathan sir.
Thank you, ma'am. Namaste and good evening to Dr. Selva Ganapathy, resource person of this evening, coordinator of this program, Mrs. Lima, students, staff, and volunteers in NIMHANS, the viewers and participants to this webinar from across the country and other parts of the world as well. I have great pleasure in welcoming you to yet another edition of this fortnightly seminar being organized by Vayomanasa Sanjeevani, an outreach arm of Geriatric departments of NIMHANS, Bangalore. I am happy to introduce the resource person of this evening, Dr. V Selva Ganapathy, MPT, PhD in PT, who is working as senior physiotherapist in National Institute of Mental Health and Neuroscience, NIMHANS, Bangalore. I welcome him on your behalf and request him to enlighten us on the important topic of managing pain. As far as his credentials are concerned, he works as a senior physiotherapist at National Institute of at NIMHANS, one of the most prestigious teaching hospitals in Asia. His job responsibilities include clinical teaching and research, as well as administration of physiotherapy services. He takes special interest to assess balance and gait and to manage various neurological disorders. He also works at the Geriatric and the Pediatric Neurology units, the Child Guidance Clinic, the Chronic Pain Clinic, and the Balance and Gait Lab. He conducts several tests to analyze movement and gait and gives treatment to correct observed disorders. Currently, he works in close association with the movement disorders wing of the neurology department. He has earned his PhD in balance and the gait research in behavioral variant frontotemporal dementia under the NIMHANS University. His research has been published in journals such as Movement Disorder, Asian Journal of Psychiatry, Journal of Neurosurgical Sciences, etc. In addition, he has earned many awards. He is a recognized visiting faculty in many teaching institutions. We are fortunate to have such a resourceful person to speak to us on an important topic, namely pain management. To be honest, I have not shared all the credentials of Mr. Selva Ganapathy. His credentials will run to several pages. Such a resourceful person he is. I briefly move away from the qualification of the speaker to the qualifications of viewers like us of this session, who do not know how to manage pain. First is we do not know why some physical discomfort is called ache, like headache, toothache, etc., while some other discomfort is called pain, knee pain, body pain, etc. Further, most of us try to manage our pain or ache by consuming some tablet obtained from our friendly pharmacists or OTC products like aspirin, antacid, etc. In certain other times, the prescribed drug to our friend or family for seemingly similar complaint is our drug for managing our pain. One more subtopic of interest to us will be the role of the physiotherapist, commonly known as physio in pain management. I may add that to most of us belonging to the grey population, we have seen a physio in test cricket matches when a player is injured. Physio will suddenly appear from somewhere and apply some ointment or spray some medicine, and immediately the injured person will be back fit to resume his duty in the ground or field. But today, most of us know the position is totally different. I am sure we would have had at least one session with a physio for one ailment or other. So that is the importance of a physiotherapist today. Therefore, we are really fortunate to have such a resourceful person to talk to us on physiotherapy, on the role of the physiotherapist in pain management and pain management as such. What we will in the next 45 minutes or so learn from Dr. Selva Ganapathy, the anatomy about pain, ache, etc. And the best possible treatment for that, a drugless treatment as well as a treatment with the drugs. Sir, we feel that we are fortunate to hear and benefit from your varied knowledge in pain management, especially in our old age, sir. Kindly go ahead with your presentation. I stop here, sir. Thank you.
Okay. Thank you, sir. Thank you for your detailed introduction. Thank you so much. May I request the host to share the screen? Yeah, slideshow we can.
It's on the.
Yeah. So next page. So before I just go in detail, let me give some few case studies. From there, we'll develop the concept of pain. We'll discuss about this pain in that after this. So case study one, say a person from Bihar, he came with a complaint of back pain. CLBP is chronic low back pain. It means long-term pain, almost for 10 years. His occupation is labor. And he is very afraid to bend down to pick up something. He was avoiding any physical activity. He is thinking that anything will further damage his back pain. Okay. Am I audible?
You are doctor. You are doctor. Absolutely no problem.
Okay. So this patient actually even quit the job because his back pain is increasing. He is complaining that his work nature is contributing to the pain, and he has also got a lot of economical issues, and he is looking for a proper diagnosis and a effective treatment, which means he might have already taken a lot of treatment, but again not really got any relief. Okay, now next slide. So this is a case study too. 55 years old lady from Karnataka, again suffering with chronic low back pain, which means long-term pain for more than 6 years. So she's a housewife. She complains the pain is very severe, and she's looking for permanent reduction because she's saying when she's getting relief, but not permanent basis. Time to time she gets relief, but sometimes the pain is not at all going. That is why she's worried. And what we call it as a biopsychosocial issue is some emotional and other issues, psychological issues. Like her situation is like this. She has 2 daughters. Both of them got married. In fact, she has given the property to them, to both the daughters. But now nobody is looking after them, like to her as well as her ailing husband. So this is the major concern for her. This is all while talking to the patient we came to know. Next. Now, this kind of long-term pain. So when we ask why do you think that you are continued to have a pain for 6 years, 10 years, how you are having such pain? So most of them says that I have got an injury. Once I fell down from a bike, or once I was traveling, I got a accident. So one of the old injury they always remember, and they're connecting that injury to the pain. Someone says that, sir, my posture or sitting position is bad, so that is why maybe I'm getting a pain. Some of them says that my job nature, I have to lift a lot of weight. Maybe because of that, my back is injured. No, that is why the pain is there. Someone says very little bit more detail, saying my spine. that is my back, is got damage. Some people says that I have got a disc problem. So like that is what the doctors might have told. So the patient is also saying that I have got a disc problem. Even someone very, very precise level, they say L4, L5 problem. That is the lumbar spine in the back. Okay, this is all their explanation or answer. And when we asked, what do you do for your back pain? So they say we took rest because as advised, again, precisely bed rest. It means not getting out of the bed and taking a lot of rest. And we have also avoid lifting weight. And since we are thinking that job is contributing to the pain, it means that I have to lift weight and also I am avoiding that job. Or sometimes I quit the job. What more we need, and we need our health now, so I don't want to do such job. So they say some medicines we take, physiotherapy we take, but thing is not getting a relief. So here I would like to introduce the concept of pain. Now we need to know what is pain, how the pain is produced in our body. If we understand, then we may be able to answer for such a difficult question, like why do some people are not getting the relief from their pain? Okay, so let us try to understand how it is. Some of them also said that I'm worried a lot of time about this pain, like I may end up in bed, nobody is going to look after. I'm also really getting mood swing and all. So we'll see, first of all, how the pain has come. Next. So answer to this, I already said, we need to understand the pain mechanism, where it is produced. Is it produced in the injured area, or like wherever you are feeling that my back is injured, my knee is paining, so knee is damaged. So where does that pain comes from? Then how this pain is becoming long term? It's all common, everyone get pain and also we get relief. But why do some people get long term pain? Same places, again, we call it as recurrent pain. So same spot, again, pain is coming, no relief is there. Why does that? Also, is more pain means more damage or what? That is also we are going to answer in this. And then what is the solution for all these things? Okay, next. Now, hope you are all able to see this picture. A little bit of anatomy. Okay, anatomy is going inside your body to see the bones, your brain, muscles. Here, few things I have shown. So you are seeing one red circle. Also, you see the number 1, that is injury or the stimulus. So it means, for example, this person is having a back pain. Maybe by lifting one weight or lifting the child, he got a sprain in the back. Okay, so commonly elders know they while lifting the child, they get a spasm and pain. So that is happening at the back, your lower back. That is, we can say at the waist level. Okay. So from that waist level, when something injury happens, it goes via small nerves to the spinal cord, which is located in this center or back portion of your body. That is, we call it as entire spine, from neck to the back, we can call it as the spine. Small bones are inside. Inside, we have a spinal cord that is protecting, that is the convey place for sending information or receiving information from the brain to the rest of the body. Okay, so this injury is conveying the impulse to some nerves to the spinal cord in the spine. From there, it takes to another further fibers and reaching to your brain. Okay, so once the information is reached to the brain that this locality, so and so area is damaged. So what does that brain does? What is the role of the brain? Role of the brain is to protect our body. For anyone, it will protect. Like if you feel that injury, so the brain work is to do some immediate action, appropriate action to safeguard the body. For that, it produces the hormones. That is why we are able to grow. We have a lot of function to do. So brain does a lot of work. So this pain information, once it reaches, it sends there is a danger to some part of the body. So it does two action. One action is it will immediately send some signals to that area, injured area, to improve the circulation. And also some cells, we call it as T cells, or we call it as the WBC. That is the protective mechanism of our body. Hope many of you might have by this time understand. Thanks to the COVID, it has given all some knowledge about immune system and all. So immediately the brain activates that sort of things. We call it as cytokines. It sends some cell mechanism over there to protect that region. Why it has to protect? If we are not able to protect, then we may further damage that place. That is why it produces the pain. So now here only the pain is being you are really experiencing it, because the brain has sent such information. You started feeling it. So it is the feeling only, but that is very much important. As I already said, to protect our body, we don't want to further damage. So that brain is sending some sensation. You are able to feel now there is something wrong. I am feeling more pain on my back. Okay, now I need to avoid moving that body part. Okay, so you will start moving very slow. So this is normal. Almost everybody experiences this. Okay, it's a normal feeling just to protect the body from danger. So pain is it. Then the intensity, however, can be varied. If two persons is suffering with the same pain, can they express same amount of pain? Not necessarily, correct? Because each one of us got a different sensitivity or different tolerance. For example, a military person may have a better tolerance of pain because they are doing lot of already heavy exercises, injury, everything is they have to bear the pain. Otherwise, they cannot do their job. But whereas a person in a domestic circumstance might have a different sensitivity, that we may be having a very quickly we may respond to the pain, right? Our tolerance may be less. And also it is depending upon the personality. Okay, some person don't react for anything much. Even the whole world is breaking, they don't really bother, isn't it? So their personality is very strong, like they don't care. But for them, some injury is there, they'll say, nothing is that. They don't care. But someone will say small injury happened, they will literally bring the whole family to their attention, right? So it is personality, it depends upon the person. We may react to the pain differently because that person may perceive the pain differently. Someone perceive less, someone perceive more. But injury may not be different. Injury may be the same amount. So here you see a person sitting in a petty shop. Okay, he has got an injury on the hand. You can see the red mark in the hand, but still he has to do that job. So he's not that much complaining. Okay, he can lift the jar also. But you see on the right side, a woman who is weaving the flowers. No, that's how her livelihood is. Like she has to earn money every day. Pain expression will be more, or sometimes the pain, she might be feeling excessive because it is her economical situation also associated with that, right? So it means two person can react differently, or their perception can be different for pain. Next. Now, coming to the chronic pain. So, till now, what we have seen is pain is produced in the brain as a protective mechanism, and it is normal and it is for everybody. But the pain expression can be vary for individual to individual based on the socio-economical circumstance. The pain intensity can be different. But here, one situation. See what happens in that, that kind of pain generally goes away because body started healing. As I already said, the two action taken by brain is one is immediately send some chemicals to protect the region, that is inflammation or swelling. Second one is healing process, it will initiate it. So once healing is completed, then you don't have pain. But some people are having continuous pain. So any simple injury without any major pathology. What do I mean by major pathologies? Somebody is having a really nerve compression, or someone is having a tumor, someone is having some tuberculosis in the spine. So those cases are different. Their symptoms also different. But simple pain without any other complications, they heal by themselves. Maximum of 3 months to 6 months, their pain is reduced and they are all right. But some people are continuing to have pain beyond 3 months. For them, we call it as they are suffering from chronic pain or they are suffering from long-term pain. Okay, so that percentage also, there are around 20% prevalence, we call it as, between the age of 20 to 59, even at the higher ages. Next. So someone raised a hand. So we want a clarity. Ramnath. Sir, Jambunathan, sir.
Yeah, sir, I will do, sir, I will request one thing, sir. See, Ramnath, see, we'll go to the question and answer session at the end of the session, sir.
Sir, till now you are all clear, or am I
Yeah,
clear?
it is clear, sir. It is clear. It is clear.
Okay, sir. Sir, Ramnath, you can reserve your question. We'll get back to you at the end.
Yeah, correct, sir.
Okay, sir. So anything, if you feel that I had to do slowly or I had to make it simple, please let me know.
So,
Okay.
so far, I think it's very simple, sir. No problem.
Okay, sir. Thank you, sir. Thank you so much.
We are able to understand.
So now these people will deal with the person who is not able to get relief. We call them as they are suffering from chronic pain, like rheumatoid arthritis, osteoarthritis, back pain, all the low back pain, chronic low back pain, all of them. Why do they suffer? The brain is already telling, that I have already sent, adequate amount of protection and your immune system to take care. But why do they suffer? Right? Though injury is healed, certain people are continue to have a different set of expression, that is increased pain. And interestingly, they are showing some persistent behavioral change. That is, they continue to avoid the physical activity. Like some injury happened, so now I will not bend only. Some injury happened, so I will not walk much. Some injury happened, I won't turn my body. I have to be very careful. No, as if my back is made up of fragile item like a glass. So they become very sensitive about their pain. So they don't want to be very active, or they don't want to take any chance. So they have fear of movement. Okay. Fear of movement means anything they do little bit different from their normal, they think that, okay, this may increase my pain. Okay. The fear is there in their body. So the fear is there in their mind. They are connecting the movement and the pain, right? So this, what happens, this is an interesting aspect. In your brain, it makes some network. Okay. What is that network? Your belief about this movement will cause my pain is registered in your brain. We call that as a plasticity in the brain. A new plasticity you are making it, that is such movement will cause pain to me. Okay, so this is what actually happening in the brain now. So once this network you created in your brain saying that if I bend down, it will create pain. If I turn, it may increase my pain. If I lift weight, it will increase the pain. Your brain will promptly listen to it. And then it makes some changes in the brain to make it very, very, very damage to your body. Okay? A little discomfort. Maybe you overstretch your or little stretch your body. That sensation in the first picture, please remember that sensation of some injury happens, it goes to the brain. Now the brain is altered. Now it will send very much amplified pain. Okay. Now you don't require a major injury to your body. A small discomfort can now propagated or it can be amplified. You will start experiencing more pain. What happens? Because you create a small network saying that my back is not safe. I cannot be, normal. I cannot do all these things. So that has created a small network in the brain that is making your overall pain response system very, very, very sensitive. This is what we call it as brain has become hypersensitive. It is called hypersensitivity of the brain. Okay. Now this person is going to have pain for anything. Any small disturbances is going to have a lot of pain. So he is going to come to you, come to the therapist or going to the doctor. The pain reduction happened for only some time. Because again, he's going to think about his injury, think about his body is not safe. Again, brain is going to respond to that by producing more pain. For brain, it is nothing. It is going to protect the body. Every time you think you are not safe, brain is sending some chemicals. Okay, prostaglandins, all this, these are the chemicals produced. Then your swelling will come, pain will come. But is there any injury? No, because injury happened long back, that has been healed. Now, body naturally heals. Okay. Now, this is what we call it as central sensitization. Next slide. So, once chronic pain people are suffering with central sensitization, they are going to have increased responsiveness of the brain to the normal or minimal abnormal input. Okay. I hope I'm clear here because this part is important. Unless you don't understand, it's difficult. But I can explain much simpler in the next pictures. So you will appreciate, I guess. Next. Now, this person, the pain is not from the injury. Now you see the numbers are shifted. The first page you have seen the numbers started from bottom to the top. Now the pain is produced from top to bottom. Like the person is thinking, my back will get worse. I don't know what I will do. What will happen to my future? Every day my pain is increasing. These are the thought process of the person. Now that information is interpreted in the brain saying that, oh, I think he's suffering with his pain, his injury. So I had to protect. Where he got injury, that same place, it will send the chemicals to produce the pain. Now you see the information coming to you can see the marking 1, 2, 3, you can see. 3 is now the pain he started feeling over the back. Just a mere thinking that my back is not safe. Next. Now, this is the comparison. Okay, the first picture on the left side is a normal pain mechanism everyone undergoes. On the right side, you see now the pain is started coming from the brain, not from the injury area, right? So this is called the chronic pain mechanism, right? So danger is perceived in the brain. Now that will produce the pain. You don't have to have an injury to produce the pain. Next. Now, such a person, for example, see the security guard in the picture. He's suffering with a back pain, but his supervisor is telling you have to lift this box and climb up to the stairs and go to a room and keep it. Now he will say, my pain will increase, my back will get further damage if I lift that box. Okay, this information in his brain is further going to produce the pain in the back. Definitely he will feel more pain because of that thought process. Now you can ask, sir, is it only that person is thinking because of that? No, it is also associated with some of the conditions. For example, a person is having a poor sleep, not sleeping properly. They are going to have this chronic pain because the brain is actually undergoes inflammation when you are not sleeping well. It means how you well. Okay, that will also make your brain very sensitive. So you are going to get more pain. Now the person is very anxious, is suffering with anxiety, is suffering with stress. So he is also always feeling some danger feeling in the mind. So he is going to increase the pain. And IBS is the condition called irritable bowel syndrome. Irritable bowel syndrome is the person is frequently going to the bathroom, like I want to use the toilet. No, so it means they are also having some suffering with some stress. They are also likely to have more pain, that is chronic pain. And sleep apnea. During sleep, some people are having this snoring, loud snoring. They are likely to have, they are also likely to have, because their oxygenation in the body is less, right? Obesity, okay? Even smoking, these are all associated conditions with chronic pain. Next. If I'm exceeding time, please inform. Okay. Now, till you understood or not, I'm not sure. But this is what we call it as the education, pain education. That pain education we have to give to the patient who is suffering with back pain, with a chronic back pain or chronic knee pain. Okay. But if I tell that, see, this is what your brain does, I don't think all the background of the people will appreciate it. Some educated people may be able to understand, okay, there is a thing called brain, your no pain is produced there. So, but we need to convey this to everyone who understands. So we have to use some metaphors. Okay. So here we have used some metaphors. You please also comment whether it makes sense or not, whether it is really useful or not. Next. So I said that the pain can be amplified in your brain. So someone will say that how is it possible? How pain can become more? So for example, if I am speaking without a mic, okay, how many people can hear? Hardly few people sitting in front of me. What if I am using a mic and how many people can hear? So many people can hear. What happens in between is, in the mic, there is an amplifier. So the amplifier role is to make the sound little bit more so that people can hear. So there is a mic and the loudspeaker, and then there is an amplifier in between. So what we mean by sensitiveness of the brain is the amplifier mechanism in the brain. I hope you understand now how it can be in the brain. It can happen, like how pain, a small disturbance can produce more pain. It's something like using an amplifier to make it enormous, make it more. Next. So some people will say, sir, I thought my pain is increasing because I have more damage. But when I'm having pain, how can you say I don't have the damage, but the pain is produced? Okay. So the example one, you see in the top, there is a fire alarm. I mean, you can see the sensors in the room where there is a fire and the smoke. You would have noticed in the big hall or in the probably in the hotels. Okay, so there is a smoke sensor, and then the fire alarm is triggered. And the second picture you see, there is no fire, yet the fire alarm has been activated. Is it possible? It may be a small fault in the sensors that is perceiving, no, there is a big fire and it can trigger. For example, in our place also, they use for puja, agarbatti. Agarbatti, they use it. That agarbatti small smoke also sensed by the sensor and it alarms the bell. Everyone will run and will see there is no fire. There is no fire. How this alarm got triggered? How it got activated? Then somebody says that, sir, I just I did some puja. So I used the agarbatti. So that agarbatti, no small smoke has produced the major alarm. Similarly, it can happen without injury. A small disturbances can actually produce a pain. Okay, that is what we call it as that. You are without damage or without increasing pain, without increasing further injury to your body, you can have a pain. Next, say for example, you walk in a normal surface and you walk in a muddy surface. Who has got a chance to fall? A person who walks on the muddy surface, a rainy place, he's going to skid and fall. Whereas a concrete road, when somebody is walking, very less chances for him to fall. So based on the terrain, the same person can experience a stable walking experience and an unstable walking experience. How is it possible? Because the terrain has been changed. The place where you are walking can be slippery, or it can be of very sensitive, easily to make you to fall. So why we are saying is, this is what we happen, this is what we are saying, hypersensitiveness in your brain with your thought process. You can also make the brain very hypersensitive so that you can easily get the pain or more amount of pain you can experience. Next. Now, by giving this education, how do you get out of the pain? I am saying that the pain is not because of your damage. It's because of your brain become more sensitive. A small stimulus is producing pain. So now you don't have to really worry. You can start relaxing so that your brain is perceiving, okay, no danger. But if you are panicking, if you are stressful about your injury, then that will produce the pain. This is something like somebody is looking at a rope and thinking that that is a snake. You see on the left side, the person is thinking there is a snake in the ladder. Okay, he has to climb the ladder, but he is thinking that there is a snake. He is worried and he is terrified. What should I do? Is tensed, showing that it is not a snake, it is just a rope. It is only mimicking as the snake. Now, once this information you receive it, you feel that yes, relaxed, now no snake. But same way, once you receive the information of your back is not injured, it is only your brain is become sensitive because of your anxiety and your stress and your thought process. You created the brain to be very sensitive. That is why the pain is coming. So now you can relax. Like how this person is now relaxed after seeing that it is not a snake, it is only a rope. So it is something like revealing the truth or revealing the pain mechanism. Once you understood the pain mechanism, that it is a long-term pain, it can be associated with other stress. So once you are able to relax. Next. Now this person is thinking, I am safe, I can be very active. The more he thinks, it is not going to happen immediately. The more he thinks he is safe, he can be active, and he started slowly doing the things which is avoiding. Now his brain is sensing it. Okay, no danger. No danger means why to produce pain? So it will not produce the pain. Okay. Yes, sir. Yeah. Next, I think we are completing, sir. Now you may you can ask. I think we are almost completing it. Now, these are the things. How danger perceived can produce and increase the pain. That's what we call it as sensitivity. Now, feeling safe also can reduce the pain. It means your brain, you can make it desensitized so that it is not going to produce the pain. Now, for that, what you need to do, you have to have a change in the belief system. If you are going to think negatively, then the pain is going to increase it, right? So you may have to think positive. Also, it can increase with your lifestyle factors, maybe other stress in your life, like the condition I explained in the beginning, some socio-economical issues. No, also can trigger because it's all in creating some fear factor in the mind. And there are areas in the brain which we call it as fear area. It's called amygdala, which will be stimulated. So that will also indirectly says that protect. So again, it will be the same. So you should know how to manage your triggers. And most importantly, the more you are going to be active, okay, this negative thoughts also or negative beliefs also changes. Also, you are started feeling that, yeah, I can move, I can walk. So I thought I cannot move, I cannot walk. But when I'm, in spite of that, when I'm walking, somehow managed to walk, I can experience no pain. Maybe it is it is not that danger. Okay. Now, also, if you maintain good lifestyle, like you have a good aerobic fitness, like you go for regular walking, do some strengthening exercise, you maintain general health very good. So there also you will be able to reduce your pain because you are already enjoying a good health. So you may not feel that negative effect of any of that stress and things like that. Next, these are the negative managing triggers. See, poor sleep may be there, then you have to have good sleep. Fear of pain will be there, that you have to reduce your fear, that avoiding activities. This is a wrong way of managing your pain. You have to be active, okay? And you should not be scared about your movement. Like you should be making small movement at least, so that you will be ensured that your movement is not causing the pain. Avoiding the friends and family. Some of them are very much socially not very active. So again, they're going to be more stressful. So just get out and talk to your friends. You will feel different perception about your pain. Your pain maybe sometimes vanish, and after sometimes again you get into a stressful situation, only you will have pain. So this shows an importance of how social activity also keep you away from this pain. You should have a healthy diet, better sleep. You should be able to manage your stress. Should start do your work slowly at least. Meeting friends and family frequently. These are the ways you can manage your triggers of increasing the pain. Next. So you may have experienced pain. Once you understand the pain, and then you also maintain a good lifestyle, or you modify your lifestyle to be very active, calm, you can practice yoga or meditation, or you have learned how to manage your triggers, then your pain also start reducing. Now you're also be very active, going for exercise, good health. Now you can be very much feeling comfortable, and you can get back to your activity, normal activity. This is how one can get out of this long-term pain. Okay. So I think with that I'll stop, because people are having some doubts. So at this point of time, I would like to stop here and thank the Vayomanasa Sanjeevani team, Dr. P.T. Shivakumar and his team, and the organizers for giving this opportunity to share my view on chronic pain. And I'm very happy to receive the questions I think Mr. Ramnath sir was asking again. Many times he was raising a hand. Yes, yes, sir.
Namaste,
Yes, sir.
sir.
Yes.
What about the when we have a pain? No, we take painkillers. What effect it does on on brain? You know, brain is the main player in this pain.
Correct.
So, what about these painkillers?
Painkillers. Painkillers, more you take, you know the danger. Understand? So more painkillers you take, your kidney function can affect. Okay. That is why over-the-counter medication, or whenever you feel pain, immediately you pop up on tablet.
Yeah.
Okay. Paracetamol, or somebody can even take more doses also. That is not a good practice. Okay. Not to immediately take painkiller. It's just not good, and it is only going to make you more sensitized about your pain. Okay, so because you are thinking that I cannot tolerate the pain, so immediately.
So how can we tolerate pain?
Yeah.
So you're educated, no? It will affect our kidneys, no?
Yes.
So how can we tolerate these pains?
Yes.
Without taking that pills.
Yes. So because we are thinking the pain is due to some damage. Okay. So once you realize that it is not any damage happened, it is only maybe the sensitive line. So you will be able to first of all understand, okay, the pain means I don't have to panic. The first thing people do is panic. They get anxiety. Okay, immediately I cannot tolerate this. So you have to immediately. I mean, in fact, I'm telling you, not do anything immediately. Like immediately taking tablet, you avoid for 2 minutes. Probably you can drink water and just get out of the room or get a fresh air, calm down. You know, maybe you can close your eyes and calm down also. What happens is, like, sudden changes in the body will happen. Okay, it will start reduce your pain. Then you can appreciate that, okay, now I can start reducing my pain. So why should I take tablet now? Okay, let me avoid taking tablet. Let me manage it by not getting panic. Try to calm down myself. Okay, then slowly you can, once the body is started feeling that it can reduce pain without tablet, now even that also become your memory. Okay, next time when the pain comes, you will not take tablet, but rather you will be calming down.
So
right?
self-suggestion is the main thing.
Yes,
Self-suggestion.
that is what I'm saying. Some people will be we are all sometimes very sensitive. Like immediately we'll do something because we are getting anxiety. We are really worried. Immediately we want relief. So this immediate relief, if you are having in our attitude, that will lead to many problems. We should not think that I should. First of all, you should believe on yourself, saying that I can control my pain or I can manage my pain. So this is not something it's going to kill me. No, I can very well tolerate. You start thinking in that direction, your thought process totally changes, and you start believing that yes, my tolerance is better now. But this is all related to chronic pain only, not an acute pain. The person who is suffering with back pain for long term, I am telling. If somebody is suffering with pain with other problems like weight loss, okay, fever, so they have to properly go to a doctor and make a diagnosis of what is the reason for the pain. So which is called it as an acute pain associated with other complications. Okay, but when pain comes with a regular natural way, you don't have to immediately do any other, or otherwise take some fermentation at least, but not painkiller immediately.
What is that fermentation?
Fermentation is nothing but taking some
the cloth and then in a warm water and then apply it. Just to
Hold
give
on,
a relief.
hot.
Some hot
Hold on, hot pack.
Hot packs. Hot packs.
Okay, thank you so much, sir.
Hello, sir. This is Dr. Mahesh Madri.
Yes, sir.
In majority of the elderly, they
Hello,
do
sir.
have lot of comorbidity. They do have a lot of comorbidities in the disc spaces and herniation and neuropathies, radiculopathy like that,
Yes, sir.
osteoporosis.
Yes,
How
sir.
safe is to use a commercially available massager in such
No.
situation?
No, not at all advised. See, this, I mean, that's what I said, that some of the pathology associated appropriate intervention has to happen. Like osteoporosis, they have to take meet the orthopedician and no appropriate intervention for that. So blindly taking a massage or with some local chiropractor sort of thing, it's not advised, sir. There are high chances of fracture.
Massager, commercially available massager. How safe they can be used?
I won't recommend them because they may not have that knowledge of that bone strength and all will be less, not to apply a lot of pressure and all. Because massage, they always think that they apply a lot of pressure. It's not a gentle massage. Physiotherapist apply massage is different than a commercially applied massage, because we know how much to apply pressure. We call it as a therapeutic massage. Our aim is to just move the fluid towards the lymph nodes, but they don't follow any such things. So I don't recommend, but unless they have some knowledge on elderly, so they have some understanding of about bone strength and things like that. So it's not that that's a good idea to have a commercially available massagers and all to.
Hello, sir. Hello.
Yes, sir.
Ramnath, you can go. Ramnath.
Hello.
Ramnath, you go ahead.
Good evening, sir. Good evening.
Good evening.
Hello, good evening, sir. Hello.
Go ahead, Ramnath. You are away. You are
Okay. I
think we need to ask one by one. I think Dr. Sorry, Chandrasekhar, you were.
Hello.
So please,
Hello, sir.
others, please mute. Chandrasekhar.
Hello. Hello, sir.
Sir, we now request Ramnath to first speak, sir, because he has been waiting for a long time.
Ramnath has spoken, huh?
No, he has not spoken, sir. He has not spoken.
Hello, sir.
Okay.
Good evening.
I don't know.
Good
Yeah,
evening,
please.
Yeah, please go ahead. Please go ahead, Ramnath.
Hello, sir. Good evening.
Good
Hello.
evening.
Sir, I am a 70-year-old man, but I am having the sciatic issue because 8 years back I had an operation in C4, C5. So for that I was doing a massage, physiotherapy for 3 years. After that it was okay. Then I again started the sciatic problem. For last 2 years I am suffering from sciatic problem, having pain in my butt and thigh and the calf muscles while walking. The leg also moving towards the right side, not uneven walking. So please advise me that now presently I'm doing some gym exercise, slight exercises as advised by the trainer. Can you advise me, sir?
Sir, actually,
not taking any painkiller.
No. Like your condition is, we call it as a pathologically, driven case. Like maybe your nerves are compressed, the sciatic nerve compressed in the disc. So that I advise.
Okay, how it happens, sir? How it is happening, sir? The nerve compression.
Yeah, it is your disc in the brain, the spinal cord. No, the disc can compress it. But then what I'm trying to say here is, your condition you have to discuss with your doctor, sir, because they would have seen you directly, examined you, and then how severe is the compression, they would have told you. So yours, I would list it.
I operate upon, sir. I operate upon C4, C5. I am moderate for 2 years.
Yes, sir. I would like to advise you to continue with your doctor, whomever you have already treatment. Please continue, because they have some reservation. No, they will be knowing better about your condition, sir. Yes,
okay. Thank you.
Yes, sir. Yes.
Gym trainer, sir. I'm not going to gym. It's not Do it, sir, to go into gym.
That's what, sir. Again, better check with your doctor, but gym
Okay.
not necessarily to be there. So there are other ways of doing exercise, sir.
Okay, sir. Thank
Your
you, sir.
physiotherapist and
Hello?
Can I
doctor.
ask a question?
Hello, sir. And under my missus is there. She's asking one question. Hello?
Yes.
Sir, some doctors say that you don't make a physiotherapist to do the exercise. You do it yourself. That will be more beneficial, they say.
Yes.
Which is really beneficial because we depend on the physiotherapist. And
Okay.
some people, they are lazy to do themselves. So they permanently depend on this physiotherapist to come home and do the exercise.
No,
Which
you
will
have
be
the answer. You already answered your question. So some of you require a motivation. No, they want somebody to come and instruct them. So
yeah.
until you get confident by yourself, you can manage. You can call your
Yeah.
physiotherapist.
Yeah.
Okay. Thank you.
Thank you.
Okay, sir. Now Chandrasekhar sir. Chandrasekhar sir, please ask, sir.
Okay. So thank you, doctor, for the information given.
Thank you, sir.
See, we usually take pain relievers for immediate relief. So what is the mechanism by which we are able to see that the pain is reduced, and for the say for 24 hours or so there is no pain, and afterwards it comes back again? So what is the mechanism by which we are able to feel like this?
Yes, sir. So we can temporarily block the pain. So it is basically working at even at physiotherapy also the same mechanism. It works temporarily. It stops the pain. It can happen in two mechanisms. One is prevention. There is inhibition. So in the brain there are some inhibitory hormones like chemicals can be produced so that your brain is not activating the routine pain mechanism, right? Also, it can produce endorphins. Endorphins is another chemicals. You will start feeling relief, right? So this mechanism can happen with physiotherapy also while giving TENS and all, electrical stimulation. With medicines also, it can stop that information to reach to certain part of the brain to perceive it as an injury. And once you do that, then you won't get the pain. So it's happening at the internal level. So these are commands received in the brain, how we alter the chemicals inside. If you alter the chemicals, you can have a relief in pain. But thing is, it's only temporary. As long as that other chemical is there to stop, then you can enjoy. Afterwards, it's routine. Again, the pain is going to come.
Not only temporary, doctor, it is also going to affect other organs as well. As you pointed out earlier.
Because, all the medicines, it has got its own side effects, but you have to weigh the benefit, right? I think your doctors are your family doctors. They will be able to advise you. Like maybe sometimes they'll say if you take this tablet, a bit some side effects you will feel. So with that, if you go with the confidence of the doctor, then I don't think there'll be a problem. Problem comes, the people take on their own. They don't consult the doctor. They immediately, that day that tablet I took, it was giving relief. So some other person might have told you take this tablet. So this is the problem. The self-medication is the problem I'm seeing.
Thank you, doctor.
Thanks. Thank you.
Any other person has any questions, sir? Madam?
Does anyone did not understand at all? Because I kept in my mind there can be a question saying that I am not able to understand what you are trying to say. Did anyone felt that way? Like your pain is produced in the brain, it is not in the back.
No, certainly not. It was very clear and points touched which are very common. As you know, sometimes we are so ignorant, as you were telling, that we swallow something. And just I remember one example, sometime about that massaging, as Dr. Mahesh or somebody was telling. See, when we go to the hair cutting salon,
Mm.
many of us have experienced now, they after the dressing and all that, they give a twist to at the neck, you know.
That is dangerous.
Hard dangerous, and he tells in Canada, sir, it will become fresh and what fresh. So somehow I managed to convince that fellow to stop that. And I want to share
You are
this with all my fellow audience people. Yeah.
Yeah. You have wisely avoided it because we have cases like people develop paraplegia. It means their arm and legs are not working because they twisted this so badly. So we should avoid such things because you see, thing is like vigorous, no way of doing anything, like enormous force you put and also you are not ready for it. No, they tell suddenly, right? And you will also be try to resist that, and then that's the thing. So those practice can be avoided, sir.
One more point about my experience, particularly about the back. It is almost 25 years I am having a back pain. But as you rightly said, and I want to repeat, in fact, what you said, is that hard back fermentation is very effective, and I don't take any tablets.
Good.
As far as possible, I keep my posture also correct. But it comes once in, say, 15 days or 1 month. Just say hello and it goes out like that.
The problem is if you start worrying about it.
Yeah, that's
not worrying that this pain, why again it's come, why it's not going. And also my said a lot of other social circumstances, my other triggers will be associated. So if you think about a bad instant or a person whom you associated with that, such memories also can bring the pain. So this is what we need to understand that time. The pain is not due to a back injury or neck injury or your arm injury. It is that memory is triggered on that area of the pain, how the pain got produced. So this is, we need to understand pain is not directly related to damage. It can be associated with many things. It can be associated with other simple thought process that my back or neck is not safe. It might be damaged further. Those thought process that we should be able to handle. I want all of you, maybe if you are able to take some tolerance about the pain and able to relax at that point of time. Though it is easy to say, someone in the beginning only bang on asked, sir, when the pain is there, you tell me how to get the relief. You are telling not to even immediately take tablet. It requires training. It is not that easy, right? I can simply say that, but then many patients told me that, sir, when you explain, it is beautifully understood. But when pain comes, again, I'm going back to the cycle of thinking again why the pain has come, who is going to give me treatment. No, I mean, it means like proper treatment. So I used to tell them for a different way, like just lie down, close your eyes and calm down, simply count or observe the breath. Okay, or maybe look at some calming objects, maybe a white marble Buddha, something which immediately change your emotions, right? So you can, that's how you can use some shortcut to make you feel little, calm. And most importantly, if you are able to manage to calm down and your pain will start going away, you can appreciate that. And it takes time or practice. It's not going to happen in a day because it has been there for so many years. It's not going to go away that easily. The tendency of our thinking pattern, tendency of our, our perception, right? So that's what.
Thanks, Dr.
Very excellent talk by Dr.
Thanks so much,
Selva Ganapathy.
Yeah. Thanks, Dr. V. One thing, Shastri Shah was telling about this hot pack. In between hot packs and cold packs, which is better, or when we are supposed to use a hot pack and when we are supposed to use a cold pack?
So, sir, initially what we used to advise is any injury happens. As you said in the beginning, somebody got injury in the cricket or sports, or when you walk, suddenly you twisted your ankle. That sort of immediate aspects we apply ice. or cold. Okay, immediately. After some time, maybe few days, after a week, if the pain is there, you can use hot water fermentation. This is the gold standard rule. Okay, but science is evolving. So now they are saying that it is not like that. We can have anything, it's up to the person. It is not necessarily in the beginning cold, later on hot. This concept is gone. So you can use it conveniently, whichever. No, but most of us feel comfortable with heat. This kind of long-term pain and all, we feel comfortable when the heat is given, you feel relaxed, right? So that is why I prefer hot. But if you apply cold also, pain will reduce. The reason is it can stimulate certain nerves which will carry the sensation to the brain very slowly. So your pain cannot be experienced because the cold sensation is giving a small modulation of your pain perception. So you may not have a pain. So cold also can reduce the pain. But it's up to you. Whichever you want to use it, you can use it.
Hello.
Yes, thanks, sir. Thanks, Doctor. That explains the whole thing. That's, I mean, in fact, we are now comfortable whether we can use hot or cold, we can use. And one thing is we have become more clear is that pain is not there in the hand or in the back. It is only in the mind or in the brain. Once we are able to talk to our brain and say, "Arey, just wait for some time, it will heal of its own accord," etc., something like that. We need to talk to our brain.
Yes.
We need to give some self-suggestions, auto-suggestions. Then I think, yes. Then
exactly. You rightly understood. Most of the time, we don't talk to ourselves. No, we can comfort our friend, we can comfort your family member, but when it comes to you, you have to comfort yourself, right? So sometimes we talk to our brain. You said no, so talk to ourselves to calm down. Someone, even in a movie, it came, all is well. This is all true. That's one of the good movie, I would say, that they introduced this.
She's gonna wish you were here.
Okay, somebody wants to listen to some music.
No, not that way. I think somewhere something is happening.
Hey, kick the click out of
here. Some hackers in the group is there.
Yeah.
Ronald is a hacker.
Yeah.
Yes, Ronald is a hacker.
It wasn't me. It was the other guy. It was Shoba. It was Shoba.
I'm trying to remove them, sir, but it's not.
Have you identified, ma?
Yeah, one John, one with the name John and Ronaldo.
Ronaldo.
Okay.
Let us continue, sir.
Yes,
Let
sir.
us see.
Fine, sir. Yeah, let's continue. So in fact, this is one of the downsides of this Zoom.
Yeah.
See, some of the meetings we are able to, some of our people are able to get in, despite of having all kinds of our own, positive things. And yes, we try to manage that. We don't allow any person without without a link to come in. We don't generally give the password, etc., etc. With all that, somebody is able to just move in, come in. And it's certain times it becomes very difficult to remove them off. Anyway, Doctor, I think we'll build more fences around this, so that this kind of things doesn't happen. Is that any other person? Any other doubt? Hello? Am I audible?
Yes, sir.
Yes. Any other doubt, sir?
No. Okay.
Any other person likes to raise any other matter, sir? Madam?
Sir, I'm 60 years old. I am suffering. I am diabetic from past 20 years. And from 94, I'm suffering from neck pain. Now, from past 15 years, I'm suffering from this problem, that is sciatica, sir.
Kindly start your video, ma. Hemavati madam.
Yes, sir.
Yeah. Please. Yeah. Tell me.
Yeah.
Tell me.
Yes.
Sir, good evening, sir.
Yeah.
I am 60 now. Age is 60 years.
Go ahead, ma. Go ahead.
Okay, sir. I'm suffering from past 92. 92, I'm suffering from neck pain. And from past 15 years, I'm suffering from this sciatica problem, sir. Disc problem. Any suggestions, sir?
Oh, sciatica, what happens? There is a nerve compression. So I would suggest you to take opinion from a neurosurgeon, like that nerve compression is causing any weakness to your muscle. Okay, or whether sensory nerves are.
Sir, I have to show to neurologist, sir.
Neurosurgeon and neurologist.
Neurosurgeons.
Yeah, so that you can take a call on whether it's compression needed any small surgical procedures, or if there is no major weakness or something, then they may advise us only simple medication and then exercises. So that exercises also can be, you can consult with the local physiotherapist. On this forum, we don't advise any specific exercise because we are not examining the patient. So you can consult the local physiotherapist, or maybe if you are you from Bangalore?
Of course, that she's from Bangalore only.
NIMHANS.
So she can, yeah, you can go to NIMHANS, madam. Madam, you can go to NIMHANS and get register as a outpatient. Just meet doctors. They will be able to suggest you a correct course of treatment. Because you are only from Bangalore, you can always go to NIMHANS. And you are 60 years old, therefore you are eligible to go for the geriatrics department as well. See, this geriatric department, they have the,
stretch this ass!
Monday, Thursday, and Friday. You can go on any of these 3 days, ma'am. Any of these 3 days.
Okay, doctor. Thank you very much.
Okay, welcome. Yes, sir.
Any other person? Yes, sir.
I request your attention. In this chat box, I see something is written in my name. I have not sent it.
It has been hacked. Follow this Khurshid. Some fellow by name Khurshid has come. That fellow was there right from the beginning. The meeting has been hacked. Therefore, I think something is coming. So, but anyway,
ending with your name and starting with my name.
Yeah. See, those fellows can use any name, sir. See, once this meeting is hacked, you see, then they try to do any kind of mischief. But anyway, we have almost come to the end of the meeting. If there is no other questions, I can simply close the meeting. So that's no problem.
Yes.
So I have muted the fellow. He cannot do anything. So in fact, continuously I am muting him. Okay, so can we finish the meeting, sir?
Yes, sir.
Okay, sir. As you may know, we have come to the end of the meeting. As you may know, Vayomanasa Sanjeevani has been established as an outreach arm of the Geriatric Department of National Institute of Health and Neurosciences, Banglaore, shortly known as NIMHANS. The team of dedicated students and volunteers and staff under the leadership of Dr. P.K. Chukumar, head of Geriatric Department, are reaching out to elders at their place of stay, like old age homes, senior citizens, colonies, etc., etc. These webinars are organized by the Geriatrics Department on every alternative Monday in English to enable senior citizens to understand from the comfort of their homes how a senior can remain active and enjoy his life, safely contributing to society as well. I request all of you to join such webinars and be benefited. I may add that these seminars are held without any commercial motive. We do not promote any products nor endorse any brand. Let us also remember that NIMHANS is organizing this on various subjects of keen interest to us by inviting experts in the chosen field. I request each one of you to talk to your friends and make them participate in these webinars and be benefited. On behalf of all of us, I heartily thank Dr. Selva Ganapathy for the excellent presentation and information provided by him for managing pain. In return for his kind presentation, let all of us bless him and pray God to shower on him and his family all the best in life. Thanks, sir. Now I request Lima to take over the presentation. Thank you.
Namaste ji. Thanks.
Thank you, Jambunathan sir, for
Thank you very much.
And
Thank you, doctor. It was very good.
Yes, ma'am, one second. Thank you, Jambunathan sir, for moderating the session, and we are very grateful to you for your service to VMS. And thank you, Jambunathan sir. And I would like to thank Dr. V Selva Ganapathy for his effort and time for giving us such an informative session for us. Thank you, Selva Ganapathy sir.
Namaste, sir. Namaste. Thank you. Tumba ಚೆನ್ನಾಗಿ ಹೇಳ್ಕೊಟ್ರಿ. Selvi sir, Selvi Ganapathy sir, ನಾನು ವ್ಯಾಸದಿಂದ ಬಂದಿರೋ.
And I would like to thank our partners, Government of Karnataka, Indian Psychiatric Society, Karnataka Chapter, Karnataka State Legal Service Authority, Nightingale Medical Trust, Bangalore Apartment Federation, Happy 60+, Samadhana Counseling Center, Icon Life Sciences, REC Foundation, and NSC Foundation. Once again, thank you all. Have a good evening. Thank you all.
Thank you, Lina. Thanks,
Thank you, sir. Thank you so much.
Yeah. Now, in fact, I would request all of you to continuously participate in such seminars because it gives lots of impetus to the speaker also. If they do not find enough participants, they also tend to, I mean, their brain also says, that's Dr. was telling about pain, about pressure. See, when they talk to more people, the brain tells us to talk more. It suggests more. But when they do not see many people, their brain also tells why you are talking. Not many people are listening. So let us give impetus. It's very difficult to organize a seminar, sir. And every time we are getting experts in the field only. Therefore, please tell your friends, let them all join these seminars and be benefited. It is ultimately for our benefit only. Thank you.
Thank you, sir. Thank you, sir.
Thank you. Good day, doctor.